Patient care providers are on a mission to get the oncology patients at Sacred Heart Children's Hospital up and moving. Emily Bloom introduces us to a new program, sparking some activity in this month's Miracle Monday.
It's called the Red Tennis Shoe Program, and for every mile walked, a patient gets a paper tennis shoe to put on the recognition board. One recent participant took that challenge to the next level, completing a marathon and achieving star status.
26 miles.
26.2.
Yeah.
Mason Diamond enjoys a good challenge.
I just liked it because I'm an athletic kid and I liked a goal to do when I was in the hospital.
But this little athlete,
I like to do basketball, football, and baseball.
Was thrown a different kind of challenge in September of last year.
Mason was diagnosed with a type of bone tumor.
He had Ewing Sarcoma, a cancer in his right index finger.
We spent a lot of days here, a lot of nights here, and it's challenging.
14 rounds of chemotherapy and a partial amputation of his finger meant a lot of time spent inside the walls of a hospital.
The challenge was to find things for him to do while he was here because he didn't always feel super sick, and so he was a lot of times was just kind of bored while he was here trying to figure out something to do.
Bored until the Red Shoe Challenge came along.
It's fun because it gets you out of the bed and moving a lot, so be more active and not just laying in bed all day.
And each step of those 26 miles contributing to his recovery.
For people, and especially children that are ill, it's just as important as for well people to stay active. It decreases their risk of infection, it decreases their risk of blood clots, and probably psychologically really improves their outlook on life just to be moving around and get out of their room.
And his parents taking each of those steps by his side.
It was a fun thing for me to do just because, again, we're stuck here too, and it was just nice to, there's not too far to go, but it was just instead of just wandering aimlessly, you kind of had a path and a purpose to go and be out.
We mostly did 2 miles a day because when it started, we were at the end of our treatment.
Mason is now all through his chemotherapy treatments and will have 3-month checkups going forward. If you would like to support the Children's Miracle Network, you can find the donation page under this story on KXLY.com. Reporting in studio, Emily Bloom for News Now.